Welcome. Thank you for showing up today for our Ready for Orbit Advising for Ob-Gyn Residency application using a team approach. We're going to take a second to introduce ourselves. Really, our goal is to make this an interactive Friday afternoon pre-storm if you're in the Northeast, and an enjoyable session. So please feel free to use the chat, because one of us will always be monitoring the chat, and raise hands as well, because we really do want it to be interactive. My name is Meredith Atkins. I am a generalist and laborist at Beth Israel Deaconess as part of Harvard Medical School's teaching affiliates, and I am the Associate Dean for UME there. Monica and Nikki, do you want to introduce yourselves?
Of course. Hi, everybody. My name is Monica Mendiola. I'm also a generalist at Beth Israel Deaconess Medical Center, and I am a former program director and currently the GME director for the department, leading the fellowships and the residency program.
Hi, everyone. I'm Nikki Johnson. I'm a generalist at Brigham Women's Hospital, and I am a former program director and currently clerkship director at Brigham Women's.
So we would love to hear who we have with us, even if you're keeping your camera off, which I totally and completely understand. Please, in the chat, if you could, share your role in advising students and share the most interesting thing that you've ever seen on a residency application. So if I were typing in this chat, I would say UME Associate Dean, and the most interesting thing I ever saw was this particular applicant of that I was reviewing her application. She was a competitive pole vaulter, and I thought that was so interesting. If you could all share in the chat now your role and something interesting. Ooh, Sarah just answered testing new Oreo flavors. I want that as a hobby as well. And again, I appreciate that you're staffing clinic and trying to listen. Totally get that. Thank you for participating. Stefan's a clerkship director, as is Sarah. I think the testing new Oreo flavors may have won the day. Ooh, Erin Nelson, also a clerkship director, culinary photographer. Also interesting. So many of these applicants I want to have coffee with. Elise, who's our UMEC liaison here, and a gyn-onc, and a level director of clerkships. Testing Ben & Jerry's ice cream, right up there with the Oreo flavors. Marissa, Rose, who's a clerkship director. Oh, the applicant was an author of a series of vampire romance novels. Also, I like that one. Although I might opt for testing Ben & Jerry's flavors. So thank you all for typing in the chat. Really appreciate it. Again, it's a small group, so feel free to, as I said, use the chat, raise your hand. We want this to be useful and interactive to all. Our learning objectives today for this session is that at the end of this session, all of you will be able to discuss the benefits of team-based advising, be able to lead applicants in a values clarification exercise, and be able to perform holistic reviews of student portfolios. We're going to start with what are the current national advising recommendations that exist. And there are a few. Obviously, the LCME, so important to all of our existence as the governing body or licensing body for our medical schools. Their 11.2 career advising. A medical school has an effective career advising system in place that integrates the efforts of faculty members, clerkship directors, and student affairs staff to assist medical students in choosing elective courses, evaluating career options, and applying to residency programs. The AAMC, their graduation questionnaire that our students take, all of our students take, includes questions on satisfaction with career advising. And the most recent national guidelines that exist is the group, the Coalition for Physician Accountability, in August of 22. The UME Education GME Review Committee released recommendations in August of 2021. And there were a ton of recommendations here for comprehensive improvement of that UME to GME transition, the process that we're talking about, the applying to residency. And they had several recommendations on this front. One of them, recommendation 6, was create an interactive database with verifiable GME program track information and make it available to all applicants, medical schools, and residency programs, and at no cost to applicants. This will include aggregate characteristics of individuals who previously applied to, interviewed at, were ranked by, and matched for each GME program track, which I think would be, obviously this has not been applied yet. I think this would be really wonderful for our applicants, and we will share with you what we've tried to do at HMS to try to provide some of that for our advisees. Their 7th recommendation was evidence-informed general career advising resources. Again, having students have free access to a single comprehensive electronic professional development career planning resource. And 8, educators should develop salutary practice curriculum for UME career advising. So lots of recommendations within this very extensive new group of recommendations that just came out in August. So while we're here, the reason why we're here talking to you today is because at HMS, coinciding with a national increase in OB-GYN applicants, we also had a significant decrease in our students at HMS reporting satisfaction with career planning services. So 2012, 2014 GQ, only 43 to 57% of students reported satisfaction with what we were doing, with the national mean higher at 62 to 65%. And over 2010 to 2014, the number of HMS students applying in OB-GYN increased from 4 to 60 a year to 9 to 12 a year. And unfortunately, during this time, several really well-qualified students didn't match. And we really needed to look at what we were doing at HMS to make sure that our students were getting what they needed in career advising and approaching the match to ultimately lead for success for themselves. So how hard is it to match an OB-GYN? This is actually 2020 data. And as you can see, this is the percentage of USMD seniors who matched in their preferred specialty. Overall, 91.2% of US seniors matched. Looking specifically at OB-GYN, it was 86%. And this is actually the 2021 NRMP applicant survey, looking at the median number of applications, interviews, and programs ranked by applicant type and their match outcome. And you can see the top group is matched and the bottom group is not matched. Looking at the median number of applications submitted, how those students, how many offers for interviews they got, and how many they attended and ranked. And the light blue is USMD seniors, the medium blue is DO seniors, and then other applicant types is that darker blue there. And really, that's one of the things, the number of contiguous ranks. How many do you rank? You can see here, this again is 2020, and this is the probability of matching with the number against the number of contiguous ranks. And right here at this like 14 to 15, this is where increasing your number of ranked programs doesn't seem to help you much. So our students are recommended to be in this range right now to make sure that they are matching. And we know that the awesome folks at APGO, many who have been involved and spoken during this great FDS conference, are involved in this Right Resident, Right program, Ready Day One. There is, Monica's going to drop in the chat for us a link to information about this grant and what they're doing. You know, looking at how many to rank, how can you signal ahead, and a standardized letter of recommendation. So many of you might have heard these discussions. It's really great to be thinking about and looking at how do we improve this process for our graduating seniors so that it is working well, both for programs and for our students, so that we can really get a good match so that there's success for our learners. So I'm going to hand over to Nikki Johnson, who is really a lead on our project at HMS, and she is going to talk to you about our advising project.
So thanks, Meredith. So in response to the problem at HMS that Dr. Atkins has just outlined, the low satisfaction with career advising, the increased number of applicants that we had, and this, unfortunately, several well-qualified students not matching, as well as to comply with the national guidelines, recommendations, and the increasing competitiveness of the application process, we developed this team-based approach to our advising. So GOAT, GYN and OB advising team, was born in 2014. It was actually created at APGO's annual meeting in 2014, where the majority of us actually from our affiliated hospitals at HMS attended. And since we are Boston based, you can see the acronym has a nod to GOAT, Tom Brady, TB12, jerseys included. Okay, next slide, please. So we started with team-based best practices that were rooted in general principles from the literature. So putting students at the center, advising that's relationship-based, getting to know the students at a personal level being critical to developing a trusting and longitudinal relationship. Having specialty-specific career advisors called FCAs, which has been shown to be particularly effective for career choice decisions and actually recommended by the AAMC, the Career in Medicine website, and it is a component of RRR. Working collaboratively among advisors and students is central, and creating and utilizing standardized advising tools and curriculum to minimize variability in experiences and really help to decrease students seeking multiple advisors' advice. We also wanted to have defined goals, namely to improve student satisfaction in career advising, with the ultimate goal of a successful match for students to help them choose wisely, but also hopefully help them minimize the stress during the process. Next slide. So GOAT has a three-part approach: the faculty team of advisors, the individual advisor support, the FCA, and a student curriculum. So our individual advisors that we already had in OBGYN formed our team, all of which were very experienced with student advising, knowledgeable about UME curriculum and the OBGYN residency application process. So mostly we are clerkship directors or former clerkship directors, as well as OBGYN educational leaders and teachers at the Harvard affiliated hospitals, some OBGYN chairs, and some former program directors or current program directors. Next slide, please. So to get into the weeds of this three-part approach. So the advising team together creates and maintains advising resources. We assign the FCA student pairs. And we have regular advising team meetings and faculty development. So this is really critical to ensure that we have constant communication and standardization of the guidance for our students. We set annual QI outcomes and review them. The FCAs are mainly involved in the values verification and holistic review of the portfolio that we're going to talk about in more detail throughout this talk. They have regular student meetings and support that accelerate in frequency as the process unfolds, and ultimately advising the students in program selection and program ranking. So the point of the student curriculum is to create transparency with the process and explain, deconstruct, and hopefully ease the stress for the students so they feel like they have some more control over the process because they know what's coming. The curriculum involves several meetings, workshops, mock interviews, and then culminates with a course. Next slide, please. So some more weeds about the team advising. So critical to the advising is that we work collaboratively with each other. So among the specialty advisors, but also among HMS's society advisors, which each student has. So the communication amongst the advisors is at minimum every 2 months, and we actually have it as a standing agenda item for every single meeting that we have throughout the year. And this helps us identify and connect with potential applicants. We create a running tab of the applicants, and we know about their individual priorities, and there are specifics about their application. We are able to stay current with the updated information, which is much easier to do as a team than to try and do individually. So we do this by attending APGO meetings, AAMC meetings, webinars, and we communicate with each other so that we can all be aware of new processes and changes that occur during this match process. So for example, the SLO that was new this year, we were able to all collaborate together and come to a consensus about how we're going to approach the SLO for our applicants. We also are able to utilize our contacts and connections and share best practices, and much easier to do as a team approach. We're also able to advocate individually and as a team for our students throughout the process. And then as far as the annual QI outcomes and review, this includes the AAMC, as well as post-match school-specific survey, and then feedback from students. So next slide, please. So each of the FCAs is charged with conducting a values verification with their student, what's important to the student, and this will be talked about in more detail. And then a holistic review of their portfolio. So from the advisor and from the program standpoint, how that student would be seen. And it's also a candid review of the competitiveness of the process for the student. Regular student meetings and support are central to what the FCA does, providing the resources that are both nationally available as well as the ones that we create, how to write a personal statement, the etiquette that's involved in asking for letters of reference, and specific nuances for their advisees. So for example, if they were participating in the couples match. The FCA also reviews the program application lists, and they generally, to standardize it, do a tiered approach with each student. So talking to each student about having some reaches and some matches and some safeties, if there is even such a thing as safeties in the OB-GYN match process, but similar to how they approach applying to college, how they approached applying to medical school. And talk about interview strategies, offer mock interviews and facilitate that. And then as a team, we collectively advocate for our students during the interview and post-interview process. And again, we're able to do that because we work collaboratively with each other, and we utilize all of our contacts that we have with other programs. Also very important is that we have worked with the student to strategize a parallel plan We don't like to call this a backup plan. We think that a parallel plan is a little softer, but this is in the event that they don't match, that we want to make sure that they've thought this through and that they do have a parallel plan. Okay, next slide. So the third aspect of our team-based advising is the student curriculum. So the annual advising schedule begins with an informational session that's hosted by the advising team. We give them updated AAMC and our RMP data, which details the recent applicant pool and residency program characteristics. We have current OB-GYN residents and fourth-year students, so they can answer questions regarding their personal experiences with the process and the match. The students are either they choose an FCA at this time, or we help us to assign them an FCA, which is usually clerkship director, associate clerkship director at their clerkship site. We hold a personal statement writing workshop, which is facilitated by faculty, and the students can, as a group, go over their personal statement and get feedback from their peers and facilitators. The ERA session is typically the second meeting that we hold, and this is resident-led, early summer typically, and this is a candid forum for the applicants to discuss the process without the faculty being present. We then coordinate and help with mock interviews, and it culminates in a preparation for residency course, which is a 4-week OB-GYN specific elective for graduating students. Next slide. So this is an example of one of the student resources that we put together and present as part of the curriculum, which includes a timeline for the match process with important deadlines. And this helps to outline the months that are going to unfold so that they're ready and can plan meetings with their FCA. Next slide, please. We will review with the students factors that programs use in selecting applicants to interview. This is NRMP program survey data, and this educates our advisees about the components of their application their programs are looking for and how to make themselves competitive. So focusing on their strengths and weaknesses. So thinking about the academic characteristics, their STEP scores, what's in their dean's letter, and then the personal characteristics, so their letters, their personal statement, and their perceived commitment to the specialty. Next slide, please. We also review factors that programs use in selecting applicants to rank. And here we're trying to highlight that their application gets them the interview, but what really affects their ranking is the importance of the interview itself and the perceived fit. So this is where their interpersonal skills and interactions during the interviews and what residents' perception really is important. Next slide, please. So we talk about matched and unmatched statistics from the NRMP research report. And this is Dr. Atkins emphasized about the concept of diminishing returns to show them that really about 12 to 13 programs result in a successful match, and other aspects that differ between matched and unmatched applicants. Next slide. So we also create our school-specific resources to show the students. So this includes aggregate match data, and this shows students where their peers have successfully matched, and also provides alumni contacts for the students. Next slide. Our school has its own equivalent of the graduation questionnaire, in which the graduating seniors are surveyed, and we include this in the resources for each year of applicants. So this is just an example of 2-year data to show you what we collect and what we can show for each specialty. So this is just one example of showing how many programs in OB-GYN the students applied to during this time period. If they had research projects, yes, no, publication, yes, no, volunteer and work experiences. Next slide. And this is another example of HMS school-specific data that we show them. This is aggregate data from 2016 to 2021 to show on average that students are applied in the high 20s, but yet only interviewed at on average 13 programs and then ranked about 12 to 13. Our hope in showing this data is to encourage students to not over apply to programs. Okay, so now I'm going to turn it over to Dr. Mendiola.
Great, thanks. So one of the key components of the SCAs is getting to know their mentees and getting to identify what their values are and how to put their portfolio forward. So in this case, I use the picture here of filling our emotional tanks. All of us know as physicians, we come across many difficult challenges in residency, and you have to figure out what's important to you, because that is what gives you the strength to push forward. And that's part of what the values clarification is in terms of identifying that with your mentee. So one of the important questions would be is, how do you get to know them? And in order to do that, you want to clarify who their essential support systems is. Is this people's? Are they teams? Are they action items? Sometimes this can go through many different forms of identifying and spending time with your mentee. But what you really want to get down to is sort of creating a vision board of who they are now, who they want to be, and what trajectory will get them there. What are the self-identities that clarify who they present into the world? What are the hobbies that keep them refreshed? What are the achievements they're most proud of? It's not necessarily always what's on their CV. And if it's not there as their mentor, you want to make sure that it is promoted somewhere along in their application to create the identity that they want to present to the world, so they can then match at the place that makes them feel whole. So sometimes this can be a vision board where you sit down, it can be a list, it could be an Excel spreadsheet. Knowing your mentee helps you identify how they would first put these things forward. And once you get through those values, you're able to move on to the next step. Next slide. From that, once you identify what your values are, you're able to identify how they can match with the programs and how they're doing their holistic reviews. A holistic review from this side of the angle is to identify how they are going to show themselves on their CV, on their application, to the people who are evaluating them on those sheets of paper. So the holistic review, for the next slide, makes what sometimes seems impossible more possible to understand. And you want to teach your mentees about what people are looking for. What are the buckets that the program directors and the residency programs are going to identify? And they can come, and the majority of them is identifying what are their leadership skills? Are they the team player? Are they the giver of the group? Are they the researcher? And what is their resiliency? In finding and filling these buckets, you can create a brand for your mentee and help them showcase that, so that when they're doing a holistic review, you're able to identify what their narrative is. What's their story? How are they going to come across? How are they going to come alive on that page and stand out amongst the sea of applicants that everyone is reading? And what you want to look for is, what is their uniqueness? What are they most proud of? Everything you found in terms of their values clarification goes into their branding, because that's how you're going to make the most successful match. And the other thing is sort of helping them see some of these things they may not identify in themselves. All of us know about the imposter syndrome. They don't know how to put their best foot forward. And these kind of key buckets help identify who they are and who they want to put on paper. Next slide. So that also helps you pare down their program selection and how to make a great match for your mentee. You blend your values clarification and your branding to help identify how to move that forward. Next slide. When you are helping your mentee sort of put together their vision of what they want to match, it goes in through a lot of different components that are important. One of them is making sure that there is a genuine alignment of their interest. What do they value? Who are they putting forward? And how is that going to match with the place that they're going to go? If there's somebody who needs to be in a specific location because of family interest, clearly they should not try and apply to places that are across the nation. If they need to have a location that is supportive for their partner, then they need to make sure that that is part of their application process. Is it important for them to have an available mentor who is going to shepherd them through certain parts of their career that would be more challenging? Are those mentors available at that place? And is that something that that program is known for? Of course, you always want to make sure that there are good support systems for whatever it is that comes through on their CV or in their narrative that helps them get through their hard days. And always align with the resources that we've looked through, help them communicate with former graduates, people who have gone to other locations, people who know about the program, creating that sort of sense of tier of how that's important. The resources we share on this program is at the end, you will have the APGO map of how things are distributed and who's who, the APGO directors, so they can identify, is there somebody that they know there that they can communicate with? And then of course, the alumni contacts of that we showed previously. So now here comes the participation part, and we're hoping this is where your ears will perk up and you guys can start putting on your thinking caps. Because it's such an intimate group, I am sure that there will be no problems with people just speaking up and just unmuting, raising your hand, or dropping in the chat bar, depending on what your feelings are. We welcome all of it. But what we're going to do today is we're going to look at a few student portfolios, some mock students of kind of generalizations of what we've seen, and ask you guys to answer a few questions about their strengths, their weaknesses, and how you advise them based on that. So we're going to look at our very first student portfolio, and we're just going to call it student 1. Who happens to be a white female who during her clerkship, during her pre-clerkship time, had her father pass away and had to take a leave of absence. Due to that, her step 1 score did take a bit of a hit, and she was able to recover for her step 2. Most notably, she was able to go on after her leave of absence and recover well, and improved her grades not only on clerkship, but also on her advanced elective. In terms of this school, you know that it's a great school. It has a good success rate of matching their students, and that they're on an honors pass grading scale. When you look at her CV, you notice a couple of thought processes. One is that she is involved in the Ob-Gyn interest group, as well as the Students for Choice, and where she has an active leadership role. She has 1 publication where she is the second author, but 2 posters on contraception. So I'll give you guys just a minute to process that and start thinking about what we're going to ask and the ideas before we go to the next page, just so you can look at this and reference it. Is what are these students' strengths? What are the potential weaknesses? And then how would you advise them on how to make a brand out of this portfolio? All right, so let's go ahead and go to the next page. So those questions are up. Alternatively, you guys can ask questions. We can go toggle back and forth if you can't remember what the CV looked like. But let's start off with the first question. What are the students' strengths? And actually, Meredith, why don't we toggle back and we'll keep it on the portfolio side. Another way of thinking about this question is, if you were there, what would you push for this portfolio to look like? What would their branding be?
So Monica, Sarah put in the chat, I'd want to know how the student feels about the death of her father. Is this something can or should be shared in her portfolio? And Elise added that she felt like leadership was a strength of hers.
Great, great. Yeah, perfect. So those are the buckets we had talked about. Like, what are the buckets that we can identify? And Sarah is very poignant in noticing, is this something she's willing to share, or is it something she's not quite ready to share? And I think it's very important to identify that sort of pivot point for your mentee. Because if they aren't ready to share, we don't want it on paper because that will cause challenge during the interview. Sarah, do you have more to say about that? Any personal experience?
No, I mean, I do have a lot of students who have experienced some kind of loss during, their medical school years. And I think the way that it is listed here as kind of a mitigating factor is really interesting, because I do think, it changes the way you look at her application from a resilience perspective, if you know that she's been through something like that and sort of been able to build from that. Whereas you don't get the necessarily resilience picture just with like, oh, low step 2, step 1 average on her clerkships. Unless you, so I think that being able to pull that in, if that's something part of the story that the student wants to tell, does change the narrative.
Absolutely. And much like in PR, your narrative is what's powerful for everyone else out there. And you can be the first one to put that narrative out there. Elise?
Yeah, I was just gonna, I totally agree with everything that's been said. I think that, yeah, it's really important to understand if the student wants to have that discussion or not, because if it's out there in their personal statement or in their application, it will definitely be asked about it. And I think some students emotionally are not maybe ready to share that, and can break down in that conversation, and that can be sometimes helpful, but sometimes not helpful when you're in an interview situation. And then I would just add that, it's hard a little bit from this little blurb what to really identify what her strengths are. I think one of the things that really helps me is to have them do an early personal statement. They love to wait to write their personal statement until the second weeks of August. And then I'm asked to, read 30 of them and then version 75 of all 30 of them, which it's impossible for me to give good feedback in that short time span. But I do think having them do that early so that they can start to really think about what their story is, and what their brand is helpful. And then the other thing I do is I have them think about their application in sort of 5 pods. And you've listed some of the pods. Leadership is a pod. Education is a pod. Kind of clinical surgical skills is a pod. Advocacy can be a pod. To think about, because those are all the pods that we're sort of looking at as programs. And then think about, what pod are they the strongest in, and how do they weave a story that puts all these little pieces that are on this page together.
Yeah, perfect. And your point to the different pods or buckets is every program sort of has its content that it's trying to fill, and your mentee can fill multiple pods across the nation in a different way that makes them a perfect match for the right place. There is a question. Oh yeah, so Elise just answered. So there was a question, what is early for getting their CV, their personal statement sort of prepped and ready to you? And Elise responds June. And I think all of us who've had to help others in the past agree that the earlier you get it, the better the narrative can be. But Nikki, is there any specific in terms of how the group decided to address this?
Yeah, so I agree with everything that's been said. We aim to have our students have a first draft in June, and that's actually when we do the personal statement writing workshop for exactly what Elise said, because otherwise you're on like draft 66, in like the end of August. The other thing that we found has helped students is that the students have to draft these bullets as part of the MSPE. And the students draft it, and then whoever writes their MSPE at the school modifies it. But in creating those bullets, it's usually 3 or 4 things that they're most proud of or they most want to highlight within research, leadership, advocacy, volunteer work. And so they've already sort of thought through that, and then that can serve as the basis to the person getting started with the personal statement. And to the other point about I totally agree. They really need to think through, are they going to include about their father passing away on their personal statement? Because if it does come, they need to be ready for it to come up in an interview. And one way to deal with that, if they are motivated to include it, is to, during the mock interviews, to purposely bring this up so that they're ready for that question. And then and then they can prepare and happily, get through it if they worry it's going to be emotional. But this does come up a lot, that we have students who are diagnosed with ADHD during medical school, and they have to overcome that, or whatever it might be, any sort of hardship about, do they include that in the personal statement or not?
Mhm. Great. So along those same lines, there was a thought process of what else should we do in order to prep or plan for this student's portfolio. So one was identify if they're willing to share about their family member passing. Let's make sure they got a narrative and get the bullet points together. And I think the other one would be making sure their personal statement is coming along so that you're not caught off at the end. What else would you potentially look at for this one to make it just a little stronger, or any suggestions, plans within summer to fall range?
So I sort of asked them to, again, look at their CV, look at these 5 different areas and identify their strengths, but also identify maybe areas where they're really missing things. Because sometimes there's an opportunity to, even though the timeline is really short, to fill in a gap in their application. And so, I've taken this opportunity with people who maybe don't have a lot of research to do a med ed project, submit an abstract to APGO, get a national presentation on their CV. It also gives them something to talk about at interviews if they're missing some talking points because they don't have a lot of sort of extracurricular activities because they've been processing the death of their father. So, those are just some of the, like on the fly, in the moment strategies, that sometimes I think you're able to do, but being careful not to just get a bunch of superficial sort of things on the CV, but trying to be thoughtful about maybe getting some other things that to broaden their application in a meaningful way.
Yeah. Great. All right, let's do this one more time, slightly different. Student portfolio number 2. So we have an African-American identified Black male who is the first to go to college and medical school within his family. He's got a step 1 of 225 and a step 2 of 240. He passed all his pre-clerkship grades, passed all of his clerkship grades, and his advanced elective came through as an honors. You know a little bit about him, and you recognize that in his prior, when he first started off, he was gung-ho about going into ortho. And so most of his focus and time and effort went into being a first author for an ortho QI project, 2 middle authors, and college, getting into the med school preparation, and a more recent poster in DEI work, as well as being involved in DEI work at the HMS. And one of his passions is being a coach for a basketball team of youth players. So looking at this, so a little bit different, but still very typical from what we see, what would you say is this particular student's strengths? How would you lead or help them find what they would like to put forward?
Elise added that the strengths were mentoring and coaching. Which I totally agree with.
I think I'd want to delve into how they came around to wanting to go into OBGYN after focusing on ortho initially, because usually there's, a very interesting sort of profound moment that they or experience that they had that brought them. And that usually tends to be something that is a very good strength and talking point during the interview.
Yeah, I would say that this person has a lot of great material for an amazing personal statement. One is the sort of ortho to Ob-Gyn transition. I'm just dying to hear the story. And then the other is around their DEI work and their personal experience as a, first generation college student. And then about the coaching. There's a lot of similarities between sort of teaching and coaching and, coming through the medical school and residency programs that I think you can draw a lot of similar skill sets.
Yes, and yes to the everything there, right? So this has got a lot of fodder for energy. What on the opposite side, would you see anything as a weakness? Where could there be something that they may have to be prepared for?
Just the passing grades in their second year.
Yeah, great. Yeah, we did purposely plop that in there to be like, okay, what could be, how do we play this off, and how would we address those questions? We're going to have to be seen. What if you aren't a serious student, right? Do you have the capacity to do something that you're not as interested in? And how are we going to make sure that that comes across as genuine?
And I think that if the student doesn't really think through and talk through their coming around to going into OBGYN, that could actually be seen as a weakness as well.
Mm-hmm.
Yeah, I want to emphasize that, Jennifer, because I definitely had those students who don't do that narrative well when they're applying, and it really hurts them when they're asked that question. If they don't have a good story, it sort of feels like, well, I didn't think I could get into ortho. And that's the last thing anybody wants at their program. So for sure. Is this a parallel plan? Yes, Elise.
Yeah,
No, I
totally
never want to
agree.
be the parallel plan.
No, I have seen it actually come through where people are double applying, and it's quite jarring to figure out, wait, am I first or second on this list?
One thing that the student could do is talk to the letter writers about, complete transparency, that on paper they look a little slow to start, that clinically their grades were just passed, but then they started really accelerating, and their learning curve was pretty steep. And so they really did well in their advanced electives, and just being transparent about that and allowing the letter writers to do that rather than them doing that in the personal statement. And I agree with what's been said. I think that sort of aha moment when they transition from ortho to OBGYN, if it's done in a genuine way, can really make who's ever reading that personal statement really want to meet this candidate. It has to be done, though, in a thoughtful, genuine way.
Yeah, great. Any additional thought processes on branding we haven't come up for as a potential for this candidate, or something you'd like to add?
I think there's a potential, again, not knowing the whole story, for resiliency. I mean, to be the first in your family to go to college and to go on to medical school, I'm sure requires a tremendous amount of fortitude. And I think, depending on the story, there's potential to have resiliency be part of their brand, or fortitude, or, something along those lines.
Mm-hmm. Mm-hmm. Great. Absolutely. And that story of, trying to say it took a while to adjust, being the 4%, right? An African-American male being the 4% amongst all medical students alone is something that has to be noteworthy. All right, so great. Moving on in the same vein, after you're looking at your mentee, I think we've addressed all these questions again, is sort of thinking, well, how do we take the idea of team advising for the underrepresented minority and giving them specific tips on how to share their experience besides their race, but what it is that means to support them. So I think a lot of it is understanding that underrepresented minority in medicine requires sponsorship. They require a mentor plus, someone with a cape who's going to stand up and help them create their narrative and their brand so they are able to present themselves in the best way. They unfortunately have had a lot of structural racism that has unfortunately held them back in life, and we want to be able to put them forward at their best capabilities. So it's important to make sure that when you are putting them out into the world, you're not throwing them to the wolves, but actually connecting them to the people who are going to continue to sponsor and support them. Make sure that when you're looking at the places that they're interested in, there's an ability for them to connect with the diversity, equity, and inclusion offices, not only at your home institution, but at institutions that they are looking at. That when they are doing their values clarification, that they identify themselves as somebody who can connect at that place. Is there something on their website that shares their values, but actually does it in a meaningful way? Is there a mentor there or someone from your network that they can talk to, that they can discuss? Has that institution put on open forums for the trainees to discuss about what their experiences are, either with the alumni, faculty, residents, or fellows that can discuss what it is to be a UIM at that institution? The other thing is ensuring that you're not just pushing them towards the best of what they can become, but understanding that they're going to have to be at a place that fosters their growth. And that may mean doing a little extra footwork of finding them sponsors, coaches, mentors, and offices at that location that you are trying to push them towards.
So another special circumstance with regards to advising is the couples match, which requires a little bit more involved advising and planning. Next slide. So many of you are already very experienced and skilled at this, and there's been some excellent informative talks at FDS about this that discuss best practices, which GOAT utilizes as well. Our approach has been to meet individually with our advisee and then together with the advisor of the other partner in the couples match. We find this to be critical in the process and multiple meetings throughout the application and then interview and then ranking process. We consider the competitiveness of the specialties and of the candidates. So if if your advisee in OB-GYN is more competitive than the partner, then that sets up a different dynamic than if their partner is equally as competitive and applying in a less competitive field. So, and then lastly, strategizing geography, emphasizing to the student that when they are engaging in a couples match, most of the time they're choosing geography over being able to match at the best possible program for the particular candidate. So making sure that they understand about regret, that may happen if the relationship doesn't continue and they wind up at a program that they may not feel was their first choice. So going through those decisions with them. Next slide. So to wrap up and just summarize our take-home messages, we've presented our model of team advising, GOAT, for our OB-GYN residency applicants. We have found that the team approach benefits both students and advisors. So for students, the consistency in the advice and resources they get, which standardizes it for them. So who they choose as an advisor doesn't determine their success. We're able to provide more connections for the students to other programs and knowledge about the programs through our collaborative, rich network of advisors. In terms of benefiting the advisors, we can learn from each other. We can keep up to date on the ever-changing guidelines that occur. So this allows for our team to have general understanding of each student's competitiveness relative to the entire group of applicants. And the collaboration lets us utilize our shared resources among the group. And then we can have a much greater alumni network within our department for connection to the applicants. So we've shown you a lot of the tools that we utilize with our applicants. We took you through a values clarification exercise review and the holistic review of the student portfolios, and how we think about the whole student to develop a narrative and help them create a brand that they then present their most authentic self to programs that aligns with their values, with the goal that they successfully match at a program that's right for them. So here's a list of the resources to help with the residency application process. There's mostly national here, but then also our HMS advising resources as well. And then we have our GOAT developed that you can develop at your own program. So aggregated match list, the tiered program list, checklist, and then interview guide. So thank you so much for attending on this Friday afternoon, and we're happy to answer any questions and further discuss.
And I was wondering, Elise was asking about elaborating on your mock interview, but it also sounds like you guys do this well and published it in MedEd portal. Do you want to share?
Sure, I'm happy to share. So we, it started in our surgery boot camp, and then I was asked to be an interviewer, and then I just basically stole it over to OB-GYN. And so what we do is we get together in an evening from like 5 to 7:30 p.m. The students come dressed for an interview. We have food available just as if it would be a real session. And then instead of there being a program like overview, we do a half hour of education around interviewing. And then the students go into our sim center and do a 20-minute interview with one faculty member with 10 minutes of feedback, and then do a second 20-minute interview with a different faculty member with 10 minutes of feedback. And then we all get back together and we debrief and kind of close out the session. And then they have the ability to watch their interview. So it's both are recorded. And when they watch their interview, they go through a self-assessment sheet. And then when it was running at its finest, after they did that, they would come back and do a third interview where to sort of be able to work on the things from the first two practice and then the self-assessment. I don't know that that's been happening in the times of COVID. And with COVID, we've just gone to doing it all virtually, which has worked, really well. So the MedEd portal thing, I think, has like some standardized questions. It has an evaluation for both faculty and students to do of the sessions. And I think it has the self-assessment that we have the students do when they watch their video. So I think that
dropped a link. I dropped a link in the chat for your.
Oh, good. I have no idea how to drop a link. So
Sarah had a question about best practices for Zoom interviews. And do you give those students that resource?
Yes, so we do. We have multiple resources for interviews. And actually the way that we do mock interviews is very similar to how Elise just discussed. So we've actually, we partner with the school hosts mock interviews, and depending on what the student is going into, they're paired with residents and then also faculty from that specialty. We find it works better if students don't know their interviewer, so it's not going to be their advisor or one of the GOAT members that they know. So that happens at HMS Central. And then if students get feedback, they have multiple interviews in one night. It used to be in person, now it's over Zoom, but they're asked to dress just like they would for an interview. They would have it in the same setting as as they're planning for the interview, so they can get feedback about the background, the lighting, and all of that. And then they're asked set questions. If we know the field, like for OB-GYN, is going to have a component of behavioral interviewing, then we make sure that the mock exam interviewers ask them some questions related to behavioral interviewing. So we have resources for the students all about behavioral interviewing, all about potential questions, sample questions that they could be asked, and then also about tips for the virtual interviews, which we update every year. We also have the residents look at those resources so that we make sure that if there's like a trend in interviews, that's included in that for each year.
So we have to stop because Christy has to sign off and open another Zoom session, but definitely can continue this conversation through the Whova app or hopefully in other venues. But this was amazing, great, strong work. And I love the goat. I mean, I just can't say enough about that.
Nikki's daughter did our graphics.
Yeah,
All
my
right.
daughter, yeah. It's so hard with the consonants of G and T and yeah. So there was a
Thank
lot
you
of
everyone
wine.
for participating.
A
We
lot
really
of wine to
appreciate
come up
it.
with that.
All